What if a lung infection is a psychological disease? A strange but important question. What if a lung infection is a psychological disease? A while ago, on our intensive care unit, we treated an elderly woman for a severe and life-threatening lung infection. Fortunately, she survived and was discharged to home. A success story which made me feel happy for her and her family. But a few weeks later, her husband contacted me and told me his version of the story. "Doctor, she's not my wife anymore. She forgets everything, she's depressed, and shouts to me. Please help me. What has happened to her?" This confused me. What if a lung infection leads to brain disease? Yearly, tens and tens of millions of people develop severe infections. And despite all our progress in treating them and lowering mortality, we only recently started to realize that up to 30 to 50%, that's a third to half, of all these survivors develop psychological problems, like a depression, anxiety, or memory loss, symptoms related to the function of the brain. But this doesn't make sense. So the question has to be, how can a lung infection lead to a brain disease? When our body encounters an infection, it produces inflammatory messengers. And these messengers activate immune cells to combat and destroy invaders like bacteria. And what we have learned is that when these messengers reach the brain, they can activate immune cells hidden within our brain. And there lies the problem. Because in certain patients, these red active immune cells become so hyperactive that they destroy healthy brain cells, that they destroy communication between brain cells. And when brain cells communicate normally, we memorize, we feel and regulate our emotions. And when normal communication falls apart, we forget, we become depressed. And in my research, I use newly developed tracers that can specifically bind these active immune cells in our brain. And this allows us for the first time to visualize, localize, and measure the activity of these immune cells in the brains of patients with an infection. And we're developing the next step, to target these immune cells and manipulate and modulate their activity. It's an exciting and new research frontier, but also extremely important, because it could lead to treatments that may stop an infection becoming a brain disease.